Ankle sprains are one of the most common injuries hikers can experience, and while they can happen to anyone, there are steps you can take to reduce your risk. In this video, we'll explore the causes of ankle sprains, how to treat them on and off the trail, and the best ways to prevent them from happening in the first place. But before I do, I'd like to introduce myself. I'm Dr. Reinberg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've also written an ebook called How to Buy Hiking Boots to Prevent Plantar Fasciitis. This book is also helpful in preventing ankle sprains while hiking. You can find a link to download it in the description below. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. What causes ankle sprains while hiking? One of the primary culprits is hiking with improper footwear. For the purposes of this discussion, I'll be primarily talking about hiking boots with ankle support. First is wearing worn-out hiking boots. Old or worn-out hiking boots can increase your risk of ankle injuries. Here's how to tell if it's time to replace your boots. First, turn your boots over and check the treads. If they're worn down or unevenly worn, it's time for a new pair. Worn treads can cause you to trip or twist your ankle. One of the key features of hiking boots is firm ankle support. Check the fabric and cushioning around your ankles. If they're worn out, they won't offer proper support. Next, cracks in the soles of your boots. This can compromise their support and stability. You may notice some of the eyelets are broken. If so, you won't be able to cinch your boots properly, which can cause instability. Finally, if you've logged over 1,000 miles on your hiking boots, it's likely time for a replacement. If you wear hiking shoes, you'll need to replace them after just 500 miles. Next is wearing the wrong size hiking boots. As we age, our feet become longer and wider. This is primarily due to weight gain and flattening out of the arches. Even if your boots were perfect a few years ago, they may no longer fit correctly. Here's how to tell if your boots are the wrong size. First, there should be at least a thumb's width between your longest toe and the end of your boots. If there isn't, they're too short. Also, if you can't wiggle your toes comfortably, you likely need a longer, wider boot. If your toenails hurt or turn black when wearing boots, visit a hiking store to get your feet measured and find the right size boot. Next, you need to match your hiking boot to the type of terrain you'll be hiking on. Different types of hiking call for different boots. The terrain you'll be hiking on should determine the type of boot you wear. First are hiking shoes or trail runners. These are more like shoes than boots and offer little help to no help regarding ankle support. Next are day hiking boots. Here you have boots that come above the ankles. This is ideal for short hikes with light loads. They provide some good ankle support. Finally are backpacking boots. This is the most durable option. They provide excellent ankle support for challenging trails and heavy loads. Ankle support provided by your boots is especially important on tougher trails. Wearing the wrong type can increase your risk of a sprain. Another risk factor for ankle sprain in hikers is overpronation or supination. This means excessively rolling your arch down or rolling out over the side of your ankles. This tendency is caused by improper foot mechanics. Those who pronate, roll their feet down and in, often have lower flat arches, while those who supinate, roll their feet out, tend to have higher arches. Next is hiking on uneven terrain. If you wander into uneven terrain, you're more likely to sprain an ankle. Stepping into holes, tripping over roots, or landing awkwardly on uneven ground are common hazards that can cause a sprain. Finally, you may be increasing your hiking time and hiking difficulty too quickly. Pushing yourself too quickly, especially with higher elevation gains or longer distances in rougher terrain, can make you much more susceptible to ankle injuries. If you twist your ankle on the trail, it's important to recognize the signs of an ankle sprain so you can treat it properly. Remember, you won't know if the ankle is broken until you get an x-ray. Keep in mind, improper treatment of a sprain can lead to problems in the future like chronic ankle sprains, chronic ankle instability. Common symptoms include pain, swelling, bruising, and tenderness around the outside or lateral side of your ankle. Every hiker should be prepared to treat an ankle sprain on the trail. During the first 24 to 72 hours, follow the RICE protocol: rest, ice, compression, elevation, and splinting. Once you get off the trail, try to stay off the injured ankle as much as possible. While complete rest used to be the standard, some experts recommend gentle movement, like drawing the alphabet with your toes to promote circulation. Ice. Be sure to carry an instant cold pack with you on the trail. Apply ice for 20 minutes at a time, several times a day, to reduce pain, inflammation, and swelling. Compression. Use an ankle wrap to support the joint, but ensure it's not so tight that it cuts off circulation. Wrap in a figure-8 pattern for optimal support. Once you're at home, keep your foot elevated above your heart level to help reduce swelling. If you need to hike out with a sprain, use a C-splint to stabilize the ankle. An ace bandage can be used if a splint is unavailable. After treating the injury on the trail, make an appointment with a podiatrist or urgent care center as soon as possible for a thorough evaluation. When you visit the office, we'll take additional steps to ensure you heal properly. First, we'll take x-rays to rule out fractures. Then we'll examine your ankle to assess the extent of tissue damage. If the tissue appears extensive, we may take an ultrasound exam or send you for an MRI. If you need to keep your ankle immobile, we'll put you in a walking boot. I often recommend non-steroidal anti-inflammatory medications, such as ibuprofen, to reduce inflammation and pain relief. But you can also start using this medication on the trail if your physician approves it. I may refer you for physical therapy to help restore strength and mobility. I'll also put a link above to a video with a guided foot and ankle exercise program that you can do at home. Finally, our office provides MLS laser therapy to promote healing. This laser can help reduce inflammation and pain and heal injuries at the cellular level, getting you back to your activities much faster. I've put a link above so you can learn more about it. Of course, it's always better to prevent an ankle sprain from occurring in the first place. To reduce your risk of ankle sprains, follow these tips. First, choose supportive boots that fit well and are designed for your type of hiking, and replace the boots that are worn out. Again, check out the ebook I mentioned at the beginning of the video called How to Buy Hiking Boots for more guidance. Warm up and stretch before hiking. Dynamic stretching and calf/Achilles stretches of at least 90 seconds can reduce the likelihood of an injury. I'll put a link above to a dynamic stretching video. If you have flat feet or high arches and roll your feet in or out, you should visit a podiatrist for an evaluation. Custom orthotics may help stabilize your feet and keep them and your ankles from spraining or twisting. Replace the insert that comes with your hiking shoes. Most shoes don't have a supportive arch insert. Even if you don't have poor foot mechanics, an over-the-counter insert can help support your feet much better than that which might come with the shoe. I recommend either Ready Orthotics, Power Steps, or Superfeet as good over-the-counter full-length supports. Build your strength to support your joints and avoid sprains. Consult a physical therapist if you're prone to recurrent ankle injuries. When you hike, stay focused on the trail. Watch your step to avoid tripping on uneven terrain. Gradually increase your hiking distance and elevation gain. Limit increases to no more than 10% per week to help your body acclimate and gain strength slowly. Finally, don't put off getting an ankle sprain checked out by your podiatrist. It could be broken, and even if it isn't, a soft tissue sprain or torn tissue can take many months to heal. Also, improperly treated sprains can result in chronic ankle instability. Don't let an ankle sprain keep you off the trail. Take these steps to prevent injuries and seek timely care if one occurs. Stay safe and enjoy your hikes.